We're here today to introduce you to Dr. Raquel Butler. And Dr. Raquel is a biomechanical medicine veterinarian. And you may not have heard of that field of expertise before. So we're going to get Raquel to tell us what is this about? Tell us about this field of expertise.
Yeah, thanks Paula. Thanks for having me here today. A biomechanical medicine veterinarian is a vet who's qualified in biomechanical medicine, which is osteopathic techniques, chiropractic techniques, and rehabilitation techniques. And the other practitioners that can be qualified in it are human osteopaths and human chiropractors. So it's an Australian-based course.
And it's got so many great applications to horse management. It's one of the reasons why we're excited to have Raquel working with us. She's going to show us so many techniques today on how you can integrate osteopathy and stretching and care into your daily horse management routine, so we can reduce injury in the horses and have happy, healthy horses. So tell us what else you do, because I know you're a lecturer as well, aren't you?
Yep. Yeah, so I'm a lecturer at Charles Sturt in equine science. So I lecture disease, injury and rehabilitation and locomotion and the equine athlete, so training the equine athlete, and a little bit into the vet science as well. So yeah, I've been there for since 3 years, 2019 I think it was. So yeah, that's one area that I have.
But there's more. There's more. Yeah, okay. What else?
So originally when I decided I wanted to get into bodywork, I did equine muscle release therapy, which is equivalent of bone therapy for animals. So I started that, I qualified in 2014 I think it was, and then I went out in my own business, integrated veterinary therapeutics, and then from there I qualified in equitaping and vetcon taping, and have done a little bit of Masterson method, a bit of upledger craniosacral therapy. What else have I done? I've done a lot of dissections with Cheryl May Davis.
Yeah. Who's a renowned anatomist.
Absolutely, yeah.
She's
she's taught me more than probably any other single person that I know. Yeah. And so I travelled with her overseas and taught with her the dissections. And I've learnt so much from the horse through dissecting them, where some people might find that a bit, cringeworthy, but it's very clean, it's done very professionally, very respectfully for the horse, and you can never learn better than seeing what we ride and what is on the outside to what's on the inside,
what's actually happening. So how do you think what we're about to do with you is going to help our subscribers?
Yeah, I think it's really important for the subscribers to understand how they can prevent injury in their horse, for one thing, and how they can recognise if something's not quite right with their horse and actually get on top of it before it ends up in an injury where you then got to rehab your horse
all over again.
And we will talk a lot about rehab and different injuries that we can rehab and different exercises we can do. But I think a more important area is prehab.
Yeah.
Getting them into a place where we don't end up in that position, and recognising that when your horse is behaving a bit off, that a lot of times there's a really good reason for that, whether it's saddle fit or the bit fit, or whether it's some kind of restrictions or strain that they've got going on in their body that is not that obvious unless you know what you're looking for.
Yeah, so it's, for us, I think it's really exciting to be able to give horse owners preventative tools, give you a whole toolbox of being able to recognise when things are starting to go a little bit askew, and we can get on top of it, and also just incorporating so many of these techniques into your daily horse management so that they can stay healthier longer.
Yeah.
Super. We'll get into it.
Sounds good.
Okay.